Hello, so we've got a shoulder assessment, otherwise known as the glenohumeral joint. We're going to be testing flexion and extension as well as internal and external rotation happening at 90 in a frontal axis sagittal plane. Then we've got internal external rotation at 0 as well as horizontal adduction and abduction happening in a transverse plane, longitudinal axis. And lastly, we've got abduction and adduction happening on a sagittal axis frontal plane. And I'm going to be making sure we use the goniometer to test any differences. So for horizontal abduction, adduction, we're going to be looking at the top of the AC joint as our point of rotation. Our moving arm is going to be the shaft of the humerus, and our stationary arm is going to be in line with the torso. That's going to be, for that range of motion. For flexion and extension, we're going to be coming onto the side here. Torso is going to be my stationary arm. Point of rotation is going to be on the lateral side of the AC joint. And then we're going to be using the shaft of the humerus as well for flexion and extension. For internal external rotation at 90, Electronon process is going to be my point of rotation. And we're going to have the fist pointed horizontal or parallel to the floor. That's going to be my stationary arm. And the shaft of the ulna is going to be my moving arm. So let's move that, internal external rotation. Horizontal adduction. Okay. Ready?
Yep.
There's Aiden. Aiden's in pain. Aiden, where do you feel your pain?
My back of my right shoulder.
Back of your right shoulder. Okay, let's have you flex. Any pain with that?
No.
Okay, and we've got a normal end feel, and it's looking firm. Let's pull you all the way back. Ooh.
That hurts a little bit.
Looks like there's a difference of about 5 degrees. We're gonna goniometer that. Careful side, pull back. Okay, it looks like 15 degrees of extension, and flex one more time. And looks like we've got about 175 degrees of flexion. And where do you feel your pain?
In the back.
Back, 0 out of 10?
Like a 3.
3, okay. And full passive on this.
That's fine.
That's okay?
Yep.
Sweet. And pull this one back one more time. And over pressure. Okay, everything's good. Get your hands out to your side, thumbs facing out, right above your head, please, as far as you can go. Okay with that?
Not really.
No? Okay.
A little bit of a stretch. That kind of was a stretchy pain.
Over pressure. Okay, we've got a normal end feel, soft tissue approximation because the head's blocking our way. We're going to goniometer one side real quick. There you go. Oh, and I didn't mention, for this we're going to be using the point of rotation of the anterior aspect of the AC joint, using the shaft of the humerus, and as our moving arm, stationary arm is going to be in line with the body. We're going to keep going over. Looks like we're getting about 180 degrees. And now I'm going to get you to try passing in front of you for adduction. Pain with that?
It's kind of like a stretching.
Just a stretch. Okay.
In the back there.
Normal end feel, soft tissue stretch. And soft tissue stretch. Cross this one right in front of you. That's okay?
Yep.
Over pressure. Good. Now hands out to your sides. And you're going to cross your body with the one arm right here. Pain with that?
A little like stretching pain in the back.
Stretch and soft tissue approximation. Normal end feel. We're going to goniometer one more time. Okay, and we've got about 45 degrees. And this side, cross over. Pain with that?
No.
Okay, and over pressure. Good. Now, same thing in that same plane. You're going to pull back this time. Pull back with this arm. And this one. Any pain with that?
Yeah.
Yeah, looks like we've also got a reduction of about 5 degrees. We're going to goniometer this real quick. And full passive.
That's fine.
That's okay?
Yeah.
Okay. And it also shows we've got about 45 degrees of horizontal abduction. And do this side one more time. Just going to over pressure. That feels okay?
Yep.
And now elbows to your side. Put the cups up to the side. There you go, wrist away. Pain with any of that?
Yeah.
Pain on this side again?
Yeah.
Okay, and 0 out of 10?
Like a 4.
Like a 4, right, just on the back?
Yeah.
Okay. And we'll get you to relax. We're not going to goniometer this. Elbow tucked in, allow me to do it.
That's fine.
That feels okay?
Yeah.
Okay. And this one, bring it up. Oh, sorry. Elbow tucked in, hands out. That feels okay?
Yeah.
And over pressure that.
That's fine.
Okay, can you please put your hand on the small of your back?
This one?
Yep. Try to push as far out as you can. Any pain with that?
No.
Okay, we're going to externally rotate that, or internally rotate that. Okay with that?
No.
Okay. And this one, the small your back?
That's a little sore.
That's a little sore. Same place?
Yeah.
Same intensity?
Yeah.
Okay, try to relax. Allow me to do it.
That's fine.
That's okay?
Yeah.
Alright. Now sit on back and get your hands out to the side one more time. We're gonna start cheering. Yeah, put your fist in the air. Pain with that?
A little bit,
A
not
little
bad.
bit. Back here?
Yeah.
Not too bad?
No.
Okay, allow me to do this. There you go.
That's fine.
That feels okay.
Yeah.
And overpressure this. It feels okay.
Yeah.
And we're gonna go over this one side. Okay, pull it back. And it looks like we're getting about 45 degrees. And now, same outwards, fists very straight. And we're gonna point them to the floor.
That's fine.
That feels okay?
Yeah.
And we're gonna overpressure.
That's a little of a stretchy
A
pain.
little bit of a stretch back here.
Yeah.
Okay. Going over that. And there we go. And look at it, also 45 degrees. Right on. Love our ranges of motion. Now we're gonna test strength.
Okay.
You're gonna keep your arm in this position. I'm gonna
Okay.
tell you to push. Don't
Okay.
let me move you, right?
Okay.
Pushing. Feels okay?
Yeah.
Pull back.
No, that
Whoa.
hurts.
Okay, 5 out of 5 strength on flexion. However, isometric resisted extension, we've got a 4 out of 10. 4 out of 5 pain. Okay, elbow tucked in, push out. Nice.
That's fine.
Pull in.
That's fine.
Nice. Push your hand in.
That hurts.
Oh, that hurts to go
Yeah,
out.
yeah.
Working out about 4 out of 5. Push in. Nice.
Fine.
Up at this 90. Pull towards your chest.
That's fine.
Okay. Pull back into me.
Ah, that
Wow,
hurts.
that's really weak. We're looking at another 4 out of 5 strength over there. And you're gonna hold your fist right here and pull up into my hand.
That hurts too.
That causes pain. Looking at another 4 out of 5. Push down to my hand. That feels okay?
Yeah.
Okay. Looking down. Another 4 out of 5. Otherwise, everything 5 out of 5. Okay. Keep your hand here. Good. Here. Good. Don't let me pull you. Nice. Don't let me push you. Good. Don't let me push your wrist in. Attaboy. Pull it in. Nice. Stay right here. Pull it to your chest. Attaboy. Push into me. Good. Push it to the sky. Nice. Pull it down to the floor. Pull it down to the floor. Good. Back to the sky. Attaboy. 5 out of 5 strength on all of that. Now, let me tell you what's going on, buddy.
All right.
Looks like we've got weakness in some extension as well as horizontal abduction at the shoulder. So that leads me to think maybe we've got a rear delt strain, maybe we've got a Hill-Sachs lesion, maybe we've got a shoulder hyperextension. However, rear delt strain, I strongly believe it's that because we've got a lack in or pain during active range of motion for horizontal abduction as well as extension as well as external rotation, and the pain's located on the back. However, when we did all those motions passively, there's nothing to note. A Hill-Sachs lesion could also cause pain in the back. However, we would most definitely see one, greater lack of weakness. So it wouldn't be around 4 out of 5, which we did note. It'd be more like a 2, maybe a 3, kind of depends on the person. Also, we would see pain with way more ranges of motion in both active and passive ranges of motion. And as I mentioned, weakness during isometric resisted motions. And then lastly, I'm suspecting a shoulder hyperextension. However, because of pain location located on the back rather than the front, that's mainly, where we're gonna feel pain on the shoulder hyperextension, as well as weakness on active flexion and pain on active flexion at the shoulder as well. Other than that, that's all I gotta say. How you feeling?
Better.
Okay, well, it looks like we're
No,
doing
I
with the
know
rear
what's
delt
going on.
strain. So
Perfect.
go with that.